coronavirus has changed all of our lives, but how will it impact our future? Does this change everything? I'm Janelle Simplinsky. On this episode of Does This Change Everything? Medical research. What is needed to help further the research efforts of doctors and clinicians already working around the clock to treat COVID-19 patients? We'll find out more from Marcin Golec, a medical doctor and health economist at the European Investment Bank. Marcin, the coronavirus has highlighted the need for active cooperation between medical researchers and doctors in the field. How has Europe's healthcare system responded?
So we have to realize that COVID-19 is a new disease and SARS-CoV-2 is a new virus, and everything what we know about this pathogen and the disease caused by this pathogen has been gathered during the last months by clinicians overworked and at risk of being infected, and by medical researchers who are assisting them, and people who are in both roles, and how European healthcare system responded. European university teaching hospitals, medical research institutes across Europe have been involved in virus research focused on COVID-19 as a disease and SARS-CoV-2 virus as a pathogen since the beginning, since the first moment, or even some research have been conducted even before this pathogen became so unfortunately famous. And also the funding scheme, so the whole machinery behind the research and behind the medical research financing machinery towards to which EIB also belongs, and this organizational machinery have responded basically immediately. The fact that there are novel drugs in clinical trials, as well as epidemiological data incorporated into models predicting disease spread, are the results of the hard work done by clinicians and researchers across the globe, including Europe. I think we all see now how important research is in order to come up with solutions to address pandemics such as COVID-19. Long-term and sustainable solutions to pandemics, as the one currently faced by all of us, can be provided through intensive medical research. I think I do not have to use the argument that an American activist, Mary Lasker, used when she was appealing for funds for the National Institute of Health from United States senators. She said, if you think, senators, that medical research is expensive, try disease. I don't have to use it because we are all experiencing in a tragic way how expensive disease can be in situations that shut down the economy in order to control the disease.
What has the European system done well under enormous pressure, and what has it done less well?
We have discovered that we have fantastic researchers and clinicians who, despite being overworked and being at risk, have been making tremendous efforts to gather knowledge about the disease and share it with us. The second thing that has worked well is that the whole machinery of funding research has immediately, including the EIB, switched to financing activities focused on COVID-19 and the pathogen SARS-CoV-2 virus. So what hasn't gone well? Europe was not ready for such a pandemic. Nobody was, basically. We may say that investments into pandemic preparedness have been underestimated and pushed back for later. Large infrastructure projects, as well as digitalization of the health sector, stockpiling of essential goods and sufficient number of skilled work have not been available. Digitalization had provided a clear advantage in handling this pandemic. Such tools as interoperability interoperable digital electronic health record, cross-border systematic exchange of information, treatment protocols, and so on, had seemed to provide a big gain in time and potentially contribute to lower death rates. What I personally feel a pity is the fact that this digitalization technology has been available, but there was no will, no funds, no time to deploy it in the field. In the future, EIB should ensure that through our projects, we contribute properly to pandemic preparedness of our promoters, including digitalization of the health sector. And we want to support our promoters in the best possible way.
It's interesting that you say that because the EIB has been financing, most recently in Poland and Ireland, medical campuses that combine medical practitioners and researchers, putting them all in one campus or one location. Would that help with the kind of information exchange you're talking about?
Medical research is very expensive. Health sector is a very fragile and complex construct, and many people think how the best to organize these complex systems so the benefit of the results so it's optimal. And the EIB have been strongly supporting collocation of medical research laboratories, university teaching hospitals, and let's not forget it, also some incubators, so translation of this research from bench to bed and the other way around, but also to the economy and to patients finally.
How does the EIB help in all of this? What can we provide that other lenders or international organizations may not be able to provide?
So what is the role of the EIB in this medical research ecosystem? I will answer using the words of the Hungarian scientist Albert Szent-Györgyi, the man who discovered vitamin C. Albert Szent-Györgyi said, "Research is four things: brains with which to think, eyes with which to see, machines with which to measure, and fourth, money to purchase them." So how the EIB can help? The EIB firstly has means. Secondly, I think that the EIB as a long-term finance institution is exactly well positioned to finance medical research, which is long-term and very costly. The EIB has huge resources needed to match this. Furthermore, financing medical research is not simple. On the contrary, it's a very complex task. It's not enough to have money. You also have to know how to invest this money so it's not wasted, or more, so it is used in an optimal way. And what the EIB has is the skills how to do this. We have decades of international experience in financing medical research.
Thank you, Marcin Golec, healthcare economist at the European Investment Bank. This is Does This Change Everything? From the European Investment Bank, the EU Bank.